Hi, my name is John Gershman. I'm a clinical professor of public service here at NYU Wagner and the director of the International Specialization. And today I'm going to talk about paying the price, the future of U.S. development in global health assistance in the context of the second Trump administration. To set the stage a little bit, what we typically call foreign aid, which includes all kinds of assistance that the United States government and taxpayers to other countries in 2023, which is the last year that we have complete data, was about $100 billion. As you can see, close to half of that was peace and security funding, so that doesn't constitute development or global health assistance. So of that $100 billion of foreign aid, about $35 billion distributed through the US, what was the US Agency for International Development, is used for development and global health activities. As you can see here, of that $35 billion, about roughly 2/3 of it or so is distributed as humanitarian aid and health assistance, followed by other types of development assistance. And you can see the largest regional recipient of what USAID funded was in sub-Saharan Africa. So that's the backdrop to the entrance of the Trump administration. And amongst its earliest actions was to take several steps that ultimately resulted by the middle of 2025 in the entire closure of USAID, the firing of thousands of staff, and the dramatic reductions in US development and health assistance that have already had severe implications. So I'm going to talk a little bit about what those actions were, what we know about the impacts, and then what's the likely future of development and global health assistance under the Trump administration. So before the second Trump administration, the United States was the world's largest bilateral donor in three areas that I'm going to talk about. Family planning and reproductive health. The US financed about 1/3 of contraceptives distributed in low and middle income countries. The US is the largest bilateral supporter of providing drugs for people who are HIV positive. And in the last 20 so years of the presence of PEPFAR, which is the Presidential Emergency Program to combat AIDS, the evidence shows us that that saved about 26 million lives and supports around 20 million people receiving treatment. The third area that I will touch on has to do with acute malnutrition, particularly of children. The US directly funded about 50% of the production of what's called ready-to-use therapeutic food. The most famous example of that is Plumpy Nut over on the left side there. And it is basically like a peanut butter paste that is very nutritious, prepared without water, and has dramatically successful impacts in reducing severe child malnutrition, particularly for children who are in their first 3 years of life. Suffering acute malnutrition during that period can lead to, if they survive, lead to very long-term cognitive and physical deficiencies. And so being able to respond to that relatively cheaply, as you can see, it costs about $45 to provide adequate treatment for a child suffering from acute malnutrition, and that these were some of the programs that were severely impacted by the cuts and the shutdown of USAID. To just give a more general sense of what positive impacts did U.S. development assistance have over the last 20 years or so, the most recent study that appeared in The Lancet estimated that USAID assistance that was specifically targeting infectious diseases in particular and combating malnutrition had saved about 92 million lives over the first 2 decades of the 21st century, of which 30 million were children under 5. So as we all know, there was a lot of activity in January of 2025 through the first half of the year that saw an immediate halting of distribution of USAID funding, cuts in staff, personnel, and reductions in overall funding. By August, about 86% of USAID's awards had been ended, and about 2/3 of the PEPFAR awards that had spending obligations in 2025 had also been terminated. So this was very dramatic cuts to very important programs. Let's see what kind of impact that had. there were all sorts of, this is just one example of one of these stories, that, these programs were terminated overnight without any plans for transition of any sort. So you had situations recently reported where you had US stockpile of contraceptives had been sitting around, had been moved, and had been stored poorly. As a result, they can't be used anymore. The Trump administration had planned to destroy them. And the Reproductive Health Supplies Corporation estimated that that single shipment alone, that is likely to be totally a wash, if it had been used, would have had significant impacts in reducing unintended pregnancies, reducing unsafe abortions, and preventing maternal mortality. So the cost to these cuts, both in their scale and scope, the amount of money, and in the way they were done, which was clearly just irresponsible, has had really negative impacts on well-being. So what have actually been the reductions in funding? So as you can see here, this is actual disbursements for 2025 in US global health programs. You can see that there's been about a 20% cut from the peak in 2024 in spending this year. You can see for disaster assistance, a little bit larger decline in spending. And development assistance overall spending, again, some declines, not massive, but that's just spending that has happened in 2025. What are the plans for spending in the future? So if we look at global health again, we see that the planned expenditures are going to be somewhere in the neighborhood of 50 to 60% of what their previous peak was. So a cut of somewhere in the neighborhood of 40 to 50%. Disaster assistance, we see a dramatic decline, about a 75% decline in planned expenditures for 2026 in disaster assistance. And other forms of development assistance, not global health and not humanitarian relief, you can see are effectively almost zeroing out, 75% cuts in those. So both, while the initial cuts have not been as massive as we might expect, the planned future decline in spending is going to be very, very severe. The best estimate scholars at Boston University have been tracking those programs that were canceled, and based on what we know about the impacts on preventing mortality as a result of those programs, the best estimates to date are that about 600,000 people, 400,000 of which were children, have already lost their lives due to the cessation of access to essential medicines, as well as the kind of ready-to-use therapeutic foods that I was showing earlier. What's kind of next? What are we likely to see kind of moving forward? Well, the same study that I cited earlier that estimated that in the last 20 years, USAID programs had saved about 90 million people's lives, they're projecting with the existing level of cuts that there's going to be 14 million deaths due specifically to those cuts, of which 4.5 million are likely to be children. We recognize there's some fuzziness in the numbers, but this is the best estimates that we have based on programs where, at least historically, we collected very good data on their outcomes and impacts. Unfortunately, the United States is not the only actor that is making cuts in its humanitarian assistance and health assistance. The United Nations is projecting to cut its emergency budget by about 50%, largely because donor countries such as the United States, the Europeans, the Japanese, and others are planning on making significant cuts in their own development assistance programs. This dramatic shift, the closing of USAID, however, does offer an institutional opportunity, an opportunity to rethink development assistance and foreign aid. And the real question is moving forward is there going to be pressure from humanitarian aid, development assistance, and health assistance advocates to be able to push the Congress to really try and propose a different way for thinking about development assistance. Just to give another indicator of how this is playing out in the nutrition field, you can see that in 2022, the US is in the green, the rest of the world is in yellow. Spent about $1.5 billion on nutrition assistance. That's going to fall by about a third, below $1 billion in 2025 this year. Similar cuts for investment in treatments for malnutrition, specifically for children, for wasting, also dramatically declined. So the US in this case is being a negative leader. The steps that the Trump administration are taking are actually inspiring and influencing other countries to make significant cuts, and that's really a problem. So the best estimates of what this, both the US leadership, quote unquote, in this area and cuts in other places, the Gates Foundation recently projected out what the likely impacts are going to be on child mortality, where previously the US and the world had been contributing to significant reductions in child mortality over the last 30 to 40 years. If those cuts continue, so the green line here is what if health funding had stayed at the level it was the year before the Trump administration came into office? That's global health funding, not just the United States. And so we would continue to see ongoing decline in child deaths. If we see cuts in the US and elsewhere that are on the scale of what's been proposed, so 20 to 30% cuts, then we're likely over the next 20 years to see somewhere between 12 and 16 million more child deaths than would otherwise happen. The light blue line is the kind of alternative scenario. If we maintain funding, pursue some other innovations, we could continue to make significant progress. That's going to require political pressure by child health advocates and others to really promote those kinds of reforms. In the face of these dramatic cuts, a number of actors, including foundations, global health advocates, and development assistance advocates, came together to try to identify those programs that were the most effective, had received cuts, and try to find alternative sources of funding for them. So the Project Resource Optimization, which is a very bad name for an organization, but it's basically a lifeboat organization that identified incredibly effective programs that lost money through the cuts to global health funding by the United States, and so far have mobilized about $113 million to support those programs and have identified another $15 million of funding gaps that still need to be filled. The worst case scenarios might be mitigated a little bit because of other funders are stepping in to support some of these programs, but there's no way that other funders can compensate for the total scale of US global health funding. Recently this fall, the Trump administration released their new global health strategy as well as their national security strategy. There are some promising elements in the global health strategy that suggest that what has been historically bipartisan support for at least some global health funding might continue in the Trump administration, but that's going to require, again, consistent pressure from global health advocates and anti-poverty advocates on Congress and on the administration, particularly the Secretary of State, Marco Rubio. But the future is quite honestly very uncertain. Even though USAID was closed down, the United States still has two other significant development assistant agencies, the Millennium Challenge Corporation and the Development Finance Corporation. So far, they seem to have evaded significant funding cuts. We'll have to see on that. The State Department is going to take over the development assistance portfolio and the global health portfolio that previously was held by USAID. The challenges there, of course, is that the US government, the Trump administration, fired the professionals who managed those programs previously, and the State Department itself does not have the human resource capabilities to effectively manage those programs. So that's something they're going to have to develop, either by hiring back some of the people they fired or building the capacity of the State Department to actually be effective at implementing those programs. Some members of Congress have pushed back against Secretary of State Rubio's claims that the cuts in global health assistance and development assistance have had no negative impacts whatsoever. And as of yet, the Trump administration has not responded to those requests. And there continue to be, almost a year later, continuing court battles over what many legal scholars suggest were illegal actions taken by the Trump administration to refuse to distribute and disperse funding that had been allocated by the Congress. So those things are going to continue as we move into the second year of the Trump administration, posing some significant challenges for development and global health advocates to try to return the United States to its position of leadership that it previously occupied. Thanks very much.